Welcome friends, let's discuss INI-CET recall question of psychiatry. This time again psychiatry has not disappointed us. Most of the questions were from the past topics, recently asked topics with few controversial questions and little bit tricky statements in questions. We start with question number 1. A 10-year-old child presenting with selective mutism is most probably suffering from. Selective mutism, you must know that mutism means not speaking. In selected situation. So in this child is not speaking in selected situation, just like in school. In school the child would not be able to speak, but at other places he would be able to speak. When he would not be able to speak in the school, the scholastic performance will decrease. So these symptoms should present for at least 1 month. So for 1 month the child is not able to speak in one setting just like school, but he would be able to speak at other places in spite of having adequate knowledge and good command on language. He is not able to speak. In DSM-5, selective mutism is capped in anxiety disorder, while in ICD-10 there is F94 code and this is elective mutism. This was about the definition and few points about selective mutism. Now the question, yes, they want to ask about the comorbidity associated with selective mutism. And it was seen that the child having selective mutism is having additional diagnosis of other anxiety disorder, just like social phobia or the name social anxiety disorder. Let me give you a line from DSM-5. In clinical setting, children with selective mutism are almost always given an additional diagnosis of another anxiety disorder, most commonly social anxiety disorder, previously called social phobia. So in this question, the answer would be childhood anxiety disorder, which is commonly associated with selective.